Hello, my name is Dr. Jeannie Budgeon, and I am a board-certified veterinary dermatologist, and today I would like to talk to you about the anatomy of the canine ear. I believe the easiest way to begin is to think about the head as a loaf of bread. As you slice this loaf of bread, you are left with a cross-sectional view of the ear canal of the dog. Now this is normal anatomy, okay? So first we have to orient ourselves the pinna or the ear flap, followed by a vertical component and a horizontal component to the external ear canal. So the external ear canal is L-shaped. The vertical canal as you enter darts downward, and the horizontal canal darts inward. The horizontal canal ends in the eardrum, which is here, and beyond the eardrum is the middle ear. The middle ear consists of an air-filled tympanic bulla. This is lined by secretory tissue and encased in bone. This is the eustachian tube, and these are the structures of the middle ear. So what's important is what occurs with otitis externa, or ear infection and inflammation. So if we look at the other side of this model, we begin by noticing that there is inflammation. There is also discharge here, likely consisting of inflammatory cells, possibly bacteria, and often odor or pain. As we progress to the vertical and the horizontal component, the canal is very narrowed. There is discharge lodged in the horizontal canal, and also a large amount of discharge or material in the middle ear. What happens with otitis externa, in many cases, the eardrum can become compromised. When the eardrum is compromised, we develop otitis media, or infection and inflammation of the middle ear. This can serve as a source or a nidus of infection to continue to seed the external ear canal, and is one reason why ear infections have a tendency to be recurrent. One of the other reasons why ear infections can be recurrent or challenging to manage is in the face of this much narrowing or swelling. One can appreciate that any medication that you place into the ear is going to have very limited penetration into the external ear canal and even more limited penetration into the middle ear. So the approach is to reduce swelling, narrowing, and inflammation, and we often will begin with a course of oral steroids, such as prednisone. This will help reduce inflammation, pain, the production of exudate, and allow us to perform a more thorough examination at the re-exam, as well as allow you to more effectively clean and medicate the ear. When otitis media is suspected, often video otoscopy or an ear flush will be recommended. We may discuss this further based on our findings at your visit today. I hope that this was helpful and that you learned important points about anatomy.